Hello there, Dr. Suleiman here once again, chronic pain GP, and today's video is about behavioural therapies in the treatment of chronic pain. So a reasonably common conversation I have with patients who are chronic pain sufferers is that the patients often say, well, someone's told me it's all in my head, doctor. Now, as mentioned previously, my reply is often tailored towards each individual patient, but in essence I try and explain that pain is indeed perceived in the periphery, and signals travel up into the spinal cord and central nervous system, i.e. the brain, where the brain interprets the signals. I then go on to try and explain how the various thoughts and feelings we have make the brain interpret those signals in a specific manner. Now, the concept of how we think and how that impacts upon our behaviour has been around for millennia. However, explaining that to patients and clinicians to some extent, and the complex interactions that our thoughts have with chronic pain, is a difficult and often time-consuming activity. So it's inevitably very difficult in a 10-minute consultation. The theory, in a nutshell, is that negative emotions, thoughts and feelings will impact negatively on the perceived pain. And of course, the converse is also true. So more positive, optimistic, nice, helpful thoughts can impact positively on perceived pain, thereby reducing the perceived perception of pain and improving the quality of life of chronic pain patients. So the broad umbrella of talking therapies can be split into the two major ones we use in chronic pain. These include the following: a cognitive therapy, which is identifying negative thoughts and feelings, and if individuals can change inaccurate thinking and distressing emotional responses, the theory is that individuals can work towards overcoming difficulties and meeting their goals. Behavioural therapies is more focused on human behaviour and looks to eradicate unwanted maladaptive behaviour, both of which are very helpful in chronic pain. In most clinical conditions and scenarios, there's often a combination and use of the two talking therapies. This is known as cognitive behaviour therapy and CBT for short. So essentially, CBT is looking at how our thoughts and feelings can impact upon our behaviour. And the aim of cognitive behaviour therapy is to make the rather often daunting challenge of managing chronic pain into smaller, more manageable chunks. Now, the research suggests that the use of cognitive behaviour therapy is useful along with a multifaceted approach to chronic pain management. This would include treatments such as physical therapies, self-management and medication. Now, CBT is often the mainstay of treatment and the main component of pain management programs, not only in this country, in the UK, but also across the world. And some of you may have been on these programs already, and hopefully you found them incredibly helpful and useful. They are often particularly helpful in patients where there is often an element of depression and anxiety along with chronic pain, which in my experience is fairly common. So how does it work? Well, it often changes the way patients contextualize their pain, helps them improve their coping strategies, can help patients view discomfort in a different way, allows pain to interfere less with the quality of life and so improving function on a day-to-day basis. Pain causes release of stress hormones which can worsen pain, and CBT can help reduce the effect of these on increased anxiety, including the hormones such as noradrenaline and serotonin. And research has also shown that it provides promotion of natural pain-relieving substances and responses. So once again, in conclusion, research has shown that CBT treatment has been shown to be incredibly useful in helping patients overcome the burden of chronic pain. But I must emphasize that it has to be part of a multifaceted approach to chronic pain management, including self-management, physical therapies, relaxation, and pain medications if appropriate. So after reviewing the research with respect to cognitive behaviour therapy in chronic pain, I've given it a thumbs up. So I would definitely advocate the use of cognitive behaviour therapy in chronic pain management. So next week, hopefully I will be talking about physical therapies and their use in chronic pain. I will aim to explain how incredibly useful the physical treatments are and essential in the management of chronic pain. So thank you for listening once again, and please remember to subscribe, share far and wide. Do try and like the page and leave any feedback down below. and thank you once again for your time.